Good day everyone, I am Sandra Leonardam and today we will be discussing all about family health nursing. By definition, it involves a set of action by which the nurse measures the status of the family as a client, its ability to maintain wellness, prevent, control, or solve problems in order to achieve health and wellness among its members. So what is family data analysis? So it is done by comparing findings with accepted standards for individual family members and for the family unit. So the nurse correlates findings in the different data categories and checks for significant gaps in information or the need for details related to a finding. So now let's move on to the system of organizing family data, which is under the data analysis. Family structures and characteristics are reflected in. The first is the data on household membership. So it pertains to the data on individual person if he is the father, the eldest, the stepmom, and the likes. So the second is the demographic characteristics, which refers to the age, the race, the gender, the ethnicity, the religion, the income, education, home ownership, sexual orientation, marital status, family size, health, and disability status. And the third is the family members living outside the household. For example, nag-abroad or they are working outside the family household and they are living outside the family household or they formed a new family. The fourth is the family mobility. From the word itself, mobility, this refers to the action done by the family. For example, in meeting their family's needs physically, the whole family finds a part-time job to contribute to their daily groceries. Then the fifth is the family dynamics, which refers to the patterns of interactions among relatives, their roles and relationships, and the various factors that shape their interaction. And the sixth is the data on family structure. This refers to the family arrangement, as mentioned, such as the nuclear family, which is deemed as the ideal family, where the two parents are present and they have a child or more. So moving on to the socioeconomic, which tackles how economic standing affects the family and their social relationships. These characteristics include the first is the data on social integration. So data on social integration, they can be referred to as social networks too. In its application, if the family has lots of capit with multiple people, it has a dramatic effect to them, either positive or negative. The second is the educational experiences and literacy, for example, college graduate or undergraduate. The third is the work history rather. It previously, if a member or someone in the family is previously worked in a famous company, or either he or she is unemployed or has bad records from previous work. And the fourth is the financial resources and leisure time interest. The fifth is the cultural influences. The sixth is the spirituality or religious affiliation. Then moving on to the family environment. So family environment pertains to physical environment inside the family's home or residence and its neighborhood. Moving on to the family health and health behavior. So these types of activities affect the family health and health behavior. The first is the family's activity of daily living. So for example, what they are doing on a day-to-day basis. For example, they are cleaning always, or they are exercising for the betterment of their physical health. And then the second is the self-care. So what are they doing? What are they doing to care for themselves? So are they eating a well-balanced diet? Are they exercising? And then the risk behaviors. For example, they are eating unhealthy foods or have a lifestyle have a sedentary lifestyle, alongside with eating unhealthy foods. Then, or um, they have practice, which are detrimental to their health. Then the health history. If someone in the family has a health history of diabetes or whatsoever diseases that they have acquired before you go to the community, or you are engaged in the family health nursing. Then comes the current health status, if he is healthy or not at the time being. And lastly is the healthcare resources that are available. So those things that were mentioned are to be used in having a family data analysis. They can be used as a basis, or the findings may be anchored to those factors that I have mentioned beforehand.
So hi everyone. So family nursing diagnosis it means that developing and implementing a nursing diagnosis helps nurses to determine the plan of care for their patients. So nursing diagnosis is a clinical judgment about individual, family, or community responses to actual or potential health problems of life processes. So kaning mga nurses mao na sila motabang pag-determine sa plano sa mga problema sa ilang patients. So it is one of the priorities. So nursing diagnosis may be formulated at several levels. So the first is as an individual family member. Then the second is as a family unit. Then the third is as the family in relation to its environment or community. Then the second one is at international. So according to NANDAT 2011, it says that serve as a common framework of expressing human responses to actual and potential health problems. Then the last is Family Coping Index. So this tool is based on premise that nursing action may help a family in providing for health need or solving a health problem by promoting the family's coping capacity. So an example of actual nursing diagnosis is sleep deprivation. So this describes human responses to health conditions, life processes that may develop in a vulnerable individual, family, and community. So it is supported by risk factors that contribute to increased vulnerability. An example of risk diagnosis is risk of shock. So the example of this is cardiogenic shock. So cardiogenic shock is a life-threatening condition which your heart suddenly can't pump enough blood to meet your body needs. So delikado ni siya kayo ay pagtagya. So this is associated with nursing intervention. So the first of it is note some variations in blood pressure or orthostatic hypotension. Then be familiar with the presence of the third heart sound. Then the third is observe signs of oligoria. Then the lastly is prepare circulatory containment measures or preparation of cardiogenic drugs.
Good day everyone, I am Devi Maricel, and for today I'll be discussing the 9 areas of assessment of the Family Coping Index. So the purpose of this is to provide a basis for estimating the nursing needs of a particular family. So the first area is physical independence. So it is the family members' mobility or ability to perform activities of daily living, such as going on daily walks, going out of bed, kanang daily grooming. Then the second area is the therapeutic competence. So it is the ability to comply with the prescribed or recommended procedures and treatment to be done at home. So kini siya nga area is kanang mag-assess siya if kabalo ang isa ka family, sunod sa isa ka reseta, kanang kabalo ba sila kanang mag-nebulize, for example, if there's an asthmatic family member, mauna na siya. So the third area is the knowledge of health condition. So understanding of the health condition are essential of care according to the developmental stages of the family members. So kini siya nga area need ni siya i-assess sa nurse, community nurse, if unsa ang mga nahibal-an nila sa family members, unsa nahibal-an nga mga health condition, or on what degree ang ilahang nahibal-an nga mga health condition and how they will cope up with it. And the fourth area is the application of principles of personal and general hygiene. So, this is the practice of general health promotion and recommended prevented measures. Kanang, for example, if isa ka family, kabalo ba sila sa basic general hygiene, kanang they wash their hands often, kanang maligo sila kanang everyday, then if they brush their teeth, anak. So, the fifth area is healthcare attitudes. So, it is the family's perception of healthcare in general. So, mao ni siya if unsa ang perception sa isa ka family with the nursing on health, mao na siya. So, the sixth area is the emotional competence. So, it is the degree of emotional maturity of family members according to the developmental stages. So, need pud ni siya i-assess sa community nurse because naay mga family members nga dili sila maka-cope up with this kind of things, kanang for example na health condition, dili ni sila emotionally maka-cope up, ma-stress sila. So, the seventh area is the family living patterns. So, it is the interpersonal relationship among family members, management of the family finances, and the type of discipline in the home. So, for example, kanang unsa ni sila nga kind of living. Like, for example, if mag-decide ang isa ka family members and how it affects their family in general. Then, the eighth area is the physical environment. So, it includes home, school, work, and community environment that influence the health of the family members. So, this is important too for the community nurse to be assessed kasi there is particular family that they're very at risk, especially if they live in a, for example, na sila sa mga sewers na ang ilahang mga water kanang dirty siya, so maka-affect ni siya sa ilahang health in a family. So the last area is the use of community facilities. So it is the ability of the family to seek and utilize as needed both environment run and private health. So kini siya nga area need ni siya i-assess sa community nurse if ang isa ka family nakahibalo ba siya sa mga healthcare nga gi-provide sa ilaha and mga benefits nga ila pwede makuha with this in return. So that concludes the 9 areas of assessment of the Family Coping Index.
Formulating the plan of care. So, planning involves priority setting, establishing goals and objectives, determining appropriate intervention to achieve goal and objectives. So, in priority setting, it is the process of making decisions about how best to allocate limited resources to improve population health. In priority setting, there are 4 things to consider. First is the family safety. A life-threatening situation is given top priority. Next is family perception. Priority is given to the need that the family recognizes as urgent or important. Next is practicality. Together with the family, the nurse looks into existing resources and constraints. Fourth is projected effects. The immediate resolution of a family concern gives the family a sense of accomplishment and confidence in themselves and the nurse. So next is establishing goals and objectives. So in establishing goals and objectives, consider the SMART method. SMART stands for specific, measurable, achievable, relevant, and time-bound. And lastly, determining appropriate interventions to achieve goals and objectives. So according to Stanscope and Lancaster 2010, the nurse's role at this stage consists of offering guidance, providing information, and assisting the family in the planning process.
Establishing goals and objectives. So the main goal of family health nursing is to desired observable family response to planned interventions in response to a mutually identified family need. While the objectives is that the desired step-by-step family response as they work toward the goal. So workable, well-stated objectives should be SMART, which stands for specific, measurable, attainable, relevant, and time-bound.
Determining appropriate interventions. Depending on the identified family needs, the goals, and the objectives, interventions may range from the simple or immediate, such as offering information about external health resources available to the family, to the complicated or prolonged, such as providing care to a family with a member newly diagnosed with pulmonary tuberculosis. Freeman and Henrich categorize nursing interventions into three types. First is the supplemental interventions. These are actions that a nurse performs on behalf of the family when it is unable to do things for itself, such as providing direct nursing care to a sick or disabled family member. Next is the facilitative interventions. It refers to actions that removes barrier to appropriate health action, such as assisting the family to avail of maternal and early childcare services. Last is the developmental interventions. It aims to improve the capacity of the family to provide for its own health needs, such as guiding the family to make responsible health decisions. This type of intervention is directed towards family empowerment. Interventions may be a mix of two or all the three of these categories, with the nurse making sure that they are appropriate to the family situation. Implementing the plan of care. Implementation is the step where the family and or the nurse execute the plan of action. The pattern of implementation is determined by the mutually agreed upon goals and objectives and the selected courses of action. When appropriate, it involves providing direct nursing care, helping the family members to do what is necessary to meet health needs and problems, or referring the family to another health worker or agency. In these instances, the nurse has to exert effort to find out what is actually happening to the family to be able to effectively deal with the situation.
Good day everyone. So for today's video, I will be discussing the evaluation. Evaluation, to evaluate, is to determine or fix the value. The evaluation is the process by which a nurse judges the value of nursing care that has been provided. As with any type of nursing care, the community or public health nurses seeks to determine the degree to which planned goals were achieved to describe any unplanned results. Evaluation is also defined as a judgment of the effectiveness of nursing care to meet client goals. In this phase, nurse compared the client's behavior responses with predetermined client goals and outcome of criteria. Formative evaluation, judgment made about effectiveness of nursing interventions as they are implemented. Formative evaluation is usually undertaken early in the development of the program to inform the providers and stakeholders about the trends and results, whether the goals of the program are likely to be fulfilled and to identify the barriers and facilitators of implementation. Formative evaluation is also usually undertaken early in the development of the program to inform the providers and stakeholders about the trends in results, whether the goals of the program are likely to be fulfilled, and to identify the barriers and facilitators of implementation. Formative evaluation, judgment made about effectiveness of nursing interventions as they are implemented. While the summative evaluation determining the end of results of family nursing care and usually involves measuring outcomes or the degree to which goals have been achieved. The summative evaluation is effectiveness of care that takes place after the intervention has have been performed, and because the nurse evaluating the sum and the bottom line and the end of results. Summative evaluation involves measurements of community responses to nursing care and interpretations of the degree which planned goals were met. Care and allows the nurse to modify the cares currently being given to improve outcomes for clients, and a nurse is a planning that involves the community in the evaluation process. Summative evaluation also helps the community public health nurse to take place after the intervention is complete, even as long as months or years later, to determine whether a long-term effect was accomplished. Aspects of evaluations are effectiveness, appropriateness, adequacy, and efficiency. Effectiveness determined of whether goals and objectives were attained, while the appropriateness, stability of the goals and objectives, and interventions, and adequacy, degree of sufficiency of goals, objectives, and interventions, while the efficiency, relationships of resources used to attain the desired outcomes. So that's the end of my discussion. Thank you for listening.
Day everyone. So for today's topic is about family nurse contact. So the family nurse relationship is developed through family nurse contacts, which may take the form of a clinic visit, group conference, telephone contact, written communication, and home visit. So the nurse uses the type of family nurse contact that is most suitable to the purpose or situation at hand. It also allows the health worker to assess the home and family situation in order to provide the necessary nursing care and health-related activities. So first example of family nurse contact is clinic visit. It takes place in a private clinic, health center, barangay health station, or in an ambulatory clinic during a community outreach activity. And the nurse is able to help the family meet their needs, ease their anxieties, and help them decide on what to do to promote their health. Its major advantage is a family member takes the initiative of visiting the professional health worker, usually indicating the family readiness to participate in the healthcare process. Because the nurse has greater control over the environment, distractions are lessened, and the family may feel less confident to discuss family health concerns. So next is group conference, appropriate for developing cooperation, leadership, self-reliance, and their community awareness among group members, and the opportunity to share experiences and practical solutions to common health concerns is a strength of this type of a family nurse contact. So there is a group conference. It allows the individual nga mo participate actively and mo share or explain sa ilahang own experiences. So the nurse can obtain the essential information to enhance the community health nursing service for the people in the community. Next is ang written communication. It used to give specific information to families such as instructions given to children through school children. So this is the least individualized. So the teaching material sent with a covering personal note commonly sent to a school child. So lastly is the home visit. It is a professional, purposeful interaction that takes place in a family residence aimed at promoting, maintaining, and restoring the health of the family or its members. So it is a professional contact made by a nurse to the client to provide necessary healthcare activities further attain objective of the health agency. So it has advantages. First, kay It allows the first-hand assessment of the home situation. Second, the nurse can seek out previously unidentified needs. And third, it gives the nurse an opportunity to adapt interventions according to family resources. Next is it promotes family participation and focuses on the family as a unit. Next is teaching family members in the home is made easier by the familiar environment and the recognition of the need to learn as they are faced by the actual home situation. And lastly is the personalized nature of home visit gives family a sense of confidence in themselves and in the agency. Its disadvantages: first, guide the cost in terms of time and effort. Second, there are more distractions because the nurse is unable to control the environment. And lastly is the nurse's safety. So that's all for the family nurse contact. Thank you.
Phases of home visit. Pre-visit phase. The nurse contacts the family, determines the willingness for a home visit, and sets an appointment with them. Before going to a home visit, the nurse must contact the family first to determine if they are willing to accept you in their home visit so that you can set an appointment with them. A plan for the home visit is formulated during this phase. The following are specific principles in a planning for a home visit. So, a plan must be made first before going to a home visit. Being a professional contact with the family, the home visit should have a purpose. The purpose is to have a more accurate assessment, to educate the family about the measures of health promotion, disease prevention, and control of health problems, to provide supplemental interventions for the sick, disabled, or dependent family member, to provide family with greater access to health resources in the community. Use information about the family collected from all possible resources, such as records, other personnel or agency, or previous contacts with the family. The home visit plan focuses on identified family needs, particularly needs organized by the family as requiring urgent attention. The client and the family should actively participate in planning for continuing care. The plan should be practical and adaptable. In-home phase. This phase begins as the nurse seeks permission to enter and lasts until he or she leaves the family's home. It consists of initiation, implementation, and termination. In initiation, it is customary to knock or ring the doorbell and at the same time, in a reasonably loud but non-threatening voice, say, "Tao po, si Kaiser po ito, nurse sa health center." On entering the home, the nurse acknowledges the family members with a greeting and introduces himself and the agency he represents. Observes environment for his own safety and sits as the family directs him to sit. Establish rapport by initiating a short conversation. States the purpose of the visit, the source of information. Implementation involves the application of the nursing process, assessment, provision of direct nursing care as needed, and evaluation. Termination consists of summarizing with the family and the events during the home visit and setting a subsequent home visit or another form of family nurse contact. Nursing care of the community. Use this time to record findings such as vital signs of family members and body weight. Post-visit phase takes place when the nurse has returned
to the nurse to the health facility. Involves documentation of the visit.
My discussion is all about the nursing bag. A nursing bag is a tool that is used by the nurse during home or community visits to be able to provide care safely and efficiently. It serves as a reminder of the need for hand hygiene and other measures to prevent the spread of infection. Nursing bag has the following contents: articles for infection control, articles for assessment of family members. Note that the stethoscope and sphygmomanometer are carried separately. So, dapat buwag jud siya, dapat di siya iusa. Articles for nursing care, sterile items, clean articles, and pieces of paper. Here are some uses of the nursing bag. Bag techniques helps the nurse in infection control. Allows the nurse to give care efficiently. Saves time and efforts by ensuring that the articles needed for nursing care are available. Bag techniques should not take away the nurse's focus on the patient or on the family members. May be performed in different ways. Pwede siya sa principle of asepsis are of the essence and should always be practiced. For infection control, here are some activities that should be practiced during home visits. Number 1. Remember to proceed from clean to contaminated. 2. The bag and its contents should be well protected from contact with any article of patient's home. 3. Line the table or flat surface with paper or washable protector on which the bag and all of the articles to be used are placed. 4. Wash your hands before and after physical assessments and physical care of each family member. So, dapat manghinaw jud una, after and before and after. Bring out only the articles needed. Dapat ang importante lang article ang imong igawas aron di kalat. Do not put any of the family's article on your paper lining or washable protector. Wash your articles before putting them back into your bag. Kailangan hugasan siya para makaiwas og mga germs. Next, confine the contaminated surface by folding the contaminated side inward. Wash the inner cloth lining of the bag as necessary. Kailangan hugasan jud siya. So that's all.
Activities for infection control. So for infection control, here are some activities that should be practiced during home visit. Number 1, remember to proceed from clean to contaminated. Number 2 is the bag and its contents should be well protected from contact with any article in the patient's home. So in that way, it will prevent the spread of any infection because the bag contains basic medication and articles which are necessary for giving care. Number 3, line the table or flat surface with paper washable protector on which the bag and all of the articles to be used are placed. So in a way, it cannot be contaminated because the arrangement of the contents of the bag and putting in washable protector should be the one most convenient to the user. Okay, it is most convenient to the user to facilitate efficiency and avoid confusion. So in number 4, wash your hands before and after physical assessment and physical care of each family member, which is important before proceeding the assessments. Number 5. Bring out only the articles needed. Because why? The contents should be cleaned very often and the supplies replaced and ready for use anytime. Do not put any of the family articles on your paper lining or washable protector. So you should consider the bag and its content clean and sterile, while articles that belong to the patients as dirty and contaminated. Wash your articles before putting them back into your bag, so in a way to prevent contamination. Confine the contaminated surface by folding the contaminated side inward. And lastly, wash the inner cloth lining of the bag as necessary. That's all, folks.